As we approach the end of April, I want to provide you with an update on where we are at with COVID-19, but also where we're at from a service delivery perspective across all of our hospitals. Thankfully, at this stage, most all of our hospital sites have recovered quite significantly from the third wave of COVID-19, which really hit in the middle of January. We can see that the numbers of COVID-19 patients on our hospital sites has reduced quite significantly, and it's at quite low levels and has remained stable for a number of weeks. We can also see that the numbers of COVID-19 patients in our ICUs is also at a very low level now, and again, that's stable too. And we can also see now that there are some benefits accruing to patients who have received the vaccine. And this is particularly evident in targeted groups such as people that are living in long-term care facilities for older people, but also amongst healthcare workers. So that's very positive development. However, there are still signs that COVID-19 is still with us and that it is still a threat. On one of our hospital sites, we have an active and a persistent outbreak that needs to be managed. And we're admitting COVID-19 patients pretty much on a daily basis still into most of our hospitals. Internationally, we can see the devastating impact that COVID-19 is having in India. And I was reminded this week of the number of staff and colleagues that are working in our hospitals across the Saolta group who are from India. And I'm sure it must be extremely difficult for you to see the images and to hear the stories of what's happening at home while you're working here. I wish you and your families well over this very difficult period. All of these are reminders to us that COVID-19 is still with us and that we need to remain vigilant. We need to adhere to the public health guidance that's given to us, and we need to stick to the rules that are given to us by government. We've been rolling out the vaccination programme across the west and the northwest of the country since the 29th of December, and really it's progressing very well. At this stage, we have 5 large centres up and running this week, from Letterkenny down as far as Galway City. We're also developing a 6th centre in Carrick-on-Shannon, and we're looking at sites for smaller centres in North Donegal, in West Donegal, West Mayo, and indeed in West Galway as well. We're being advised that the numbers of vaccines that are going to be made available to us will increase quite significantly as we progress through the month of May and into the month of June. So we're preparing for that, and we're continuing to recruit staff so that we'll be in a position to use all of those vaccines as they become available. We have seen since the start of the vaccination programme that there have been many hiccups and problems along the way, but one of the features of it has been our ability and our willingness to adapt to all of those problems as they arise and to find solutions to them. There's no doubt that we will have to continue to do that over the coming months as we finish out this vaccination programme. We can see now that all of our hospital sites are starting to get busier. There are greater numbers of patients attending at our emergency departments on all sites. We can see that the numbers of admissions to hospital is increasing as well. And unfortunately, we can also now start to see that the numbers of patients awaiting admission on trolleys is also increasing. Over the last number of months, I've been asked by many people to pass on my thanks to healthcare workers working in the Saolta Hospital Group. Not least of which was the Taoiseach when he visited Galway a few weeks ago, the Minister for Health, CEO of the HSE, Paul Reid. Indeed, my own friends and family have asked me at times to make sure to pass on their thanks as well to people working in the health services. And we all know of patients that have recognised the good work that has been done and have been asking for their thanks to be passed on as well. So I do want to thank you for everything that you've been doing over the last number of months, helping us to get through COVID safely, helping us at this critical period to make sure that we stay vigilant and that we roll out the vaccine programme and that we continue to provide the best care that we can to people living in the West and Northwest.